Welcome to the National Diabetes Prevention Program, or National DPP, New Organization Orientation Webinar, presented by the Centers for Disease Control and Prevention's Diabetes Prevention Recognition Program, or DPRP. There are several benefits associated with being a CDC-recognized organization. Recognition is linked to national quality standards and outcomes that prevent or delay type 2 diabetes. Through data submissions, CDC helps monitor an organization's progress. In addition, more and more private and public insurers, like Medicare, are reimbursing CDC-recognized organizations offering the year-long National DPP Lifestyle Change Program. CDC-recognized organizations have access to technical assistance, training, and resources that can help them be successful in their delivery of this type 2 diabetes prevention program. CDC recognition can be an effective outreach tool to encourage referrals and enroll participants. It's important to note that organizations can deliver the program as a CDC-recognized organization only after receiving approval of their DPRP application. How will an organization be successful in implementing the National DPP Lifestyle Change Program? As a new CDC-recognized organization, it is essential that organization staff read and understand the DPRP standards and operating procedures, also referred to as the DPRP standards, completely before starting classes. All organizations should take the Organizational Capacity Assessment found in Appendix A of the DPRP standards to identify any areas needing improvement and assess your readiness to deliver the program. An organization must have the capacity to offer each cohort of participants a full year's worth of sessions. This includes at least 16 weekly sessions in the first 6 months and at least 6 monthly sessions in the second 6 months. In addition, organizations must begin offering the Lifestyle Change Program within 6 months of the effective date and enroll enough eligible participants to ensure that the minimum participant requirement is met. To fully understand the requirements, organizations should attend webinars, review knowledge articles, and use the other resources found on the National DPP Customer Service Center. Organizations have the option of delivering the program using any or all of the 5 different delivery modes: in-person, distance learning or live, in-person with a distance learning component, online, not live, and combination with an online component. In-person delivery requires that an organization deliver the program 100% in person by a formally trained lifestyle coach. This means that participants are physically present in a classroom-like setting. Organizations that conduct makeup sessions via a mode other than in-person are still considered to have CDC recognition for an in-person program. Distance learning, or live delivery, requires that an organization deliver the program using a remote classroom or through telehealth. This could include conference calls or other video conferencing platforms. In this delivery, the trained lifestyle coach is present in one location and participants call in or video conference from another location. Organizations that conduct makeup sessions via a delivery mode other than distance learning are still considered to have CDC recognition for a distance learning program. In-person with a distance learning component requires the program to be delivered live, either in person or distance learning, during which a formally trained lifestyle coach delivers sessions real-time to all participants. Participants have the option of attending sessions physically in person or via a remote classroom or through telehealth. For example, the lifestyle coach could provide live delivery of session content in one location, and participants call in or video conference from another location. Some examples of what in-person with a distance learning component delivery could look like are: 1. A combination of in-person and distance learning during the core and core maintenance phases, or some participants within a cohort using in-person delivery and some participants using the distance learning delivery mode, or participants choose from session to session which mode they wish to use, or entire cohorts that are 100% in person or 100% distance learning. Online or non-live delivery requires that an organization deliver the program 100% online for all participants. This means that participants log into course sessions using a phone, tablet, or laptop in an asynchronous classroom. Online sessions can be self-paced, where participants experience the content in their own time without a live lifestyle coach teaching the content. Although online sessions are not led by a trained lifestyle coach, live lifestyle coach interaction is required. The DPRP requires that lifestyle coaches schedule time with the participant for live interaction during weeks when the participant has engaged with content. Emails and text messages can count toward the requirement for live coach interaction if there is bi-directional communication. Please note that chatbots and AI forums do not count as live lifestyle coach interaction. Finally, a combination with an online component delivery requires that an organization deliver the program as a combination of online, non-live, with in-person and/or distance learning. Regardless of the number of live sessions provided under this delivery mode, the organization cannot be considered a live delivery program, like in-person or distance learning. Please note, all data collected from each delivery mode are consolidated. Some examples of acceptable combination with an online component delivery include: 1. Using one modality such as in-person and/or distance learning in the core phase of the program and online in the core maintenance phase. 2. Using a consistent delivery approach with 2 or 3 modalities for each participant in a rotating manner. For example, one session could be in person while the next session is online. 3. Conducting entire cohorts using different delivery modes. For example, one cohort would be in person and/or via distance learning, and another cohort online. 4. Some participants within a cohort using one delivery mode and some participants within the same cohort using the other. Or 5. Participants choose from session to session which mode they wish to use. As participants are enrolled in the program, there are some things to remember about eligibility. The Lifestyle Change Program is a program for adults. Participants must be at least 18 years old. Participants must have a body mass index, BMI, of at least 25, or at least 23 if the participant is Asian or Asian American. In addition, participants must be eligible based on at least one of several criteria for determining risk. The first eligibility option is a blood test indicating a prediabetes diagnosis within a year before enrollment. For CDC recognition purposes, the blood test can be self-reported, but self-reported values are not allowed for MDPP participants. Blood test results must meet one of the following specifications. 1. Fasting glucose of 100 to 125 milligrams per deciliter, or between 110 and 125 milligrams per deciliter for MDPP participants. 2. Plasma glucose of 140 to 199 milligrams per deciliter measured 2 hours after a 75-gram glucose load. Or 3. A1C of 5.7 to 6.4. A second option for showing eligibility is a clinical diagnosis of gestational diabetes mellitus during a previous pregnancy. The final way to show eligibility is through a positive screening for prediabetes based on the prediabetes risk test. Please note that this is not an option for MDPP participants. Participants cannot be pregnant at the time of enrollment, and they must not have a previous diagnosis of type 1 or type 2 diabetes at the time of enrollment. A healthcare professional may refer potential participants to the program, but a referral is not required for participation in the Lifestyle Change Program. There are a few things to take note of once an application is approved. An organization's approval date is the date the application was approved for CDC recognition. It is not the date the application was submitted. Organizations cannot submit data on participant cohorts that began before the application was approved. Sessions and data collection may begin on or after the approval date, but must begin within 6 months following the effective date. The effective date is the first day of the month following the approval date and sets the timeline for data submissions. It is also considered the first day of sequence 1. The 6-month periods between data submissions are referred to as sequences. Each organization will submit data once every 6 months, starting from the effective date, and have the entire submission month to submit their data. The DPRP awards 4 categories of recognition: pending, preliminary, full, and full plus. Pending recognition is CDC recognition. Organizations do not have to achieve preliminary or full recognition to be considered CDC recognized. CDC pending recognition is given to organizations that meet requirements 1 through 4 as outlined in the DPRP standards. These 4 requirements include the approval of a submitted application for recognition, the indication that an organization is using a CDC-approved curriculum, and the agreement to abide by the duration and intensity requirements for the Lifestyle Change Program. Please remember that the duration of the program is 1 year. In the first 6-month phase, also known as the core phase, a minimum of 16 weekly sessions must be held between a period of 16 weeks and 26 weeks. After the core phase, the second 6-month phase, known as core maintenance, requires at least 1 session to be delivered each month for a minimum of 6 sessions. Organizations may deliver additional sessions beyond the minimum requirement, as this can help participants receive additional support. Data from these sessions, however, will not be evaluated. Please keep in mind that each session must have a duration of approximately 1 hour. Once requirements 1 through 4 have been met, an organization will receive an org code from the DPRP, and it will be assigned an effective date. The effective date is the first day of the month following the approval date and is used to determine due dates for required data submissions. An organization may not begin offering sessions until DPRP application approval is given and recognition awarded. Organizations may advance to preliminary recognition at several points in their timeline once requirements 1 through 4 for pending recognition are met. First, organizations may immediately advance to preliminary recognition at the time of application approval if they are serving a population that resides in a county classified as having high vulnerability according to the CDC ATSDR Social Vulnerability Index, or SVI. Social vulnerability refers to the potential negative effects on communities caused by external stresses on human health. Organizations that want to be considered under this provision need to indicate their interest on the DPRP application. After submitting their interest, organizations will be assessed to determine their capacity and experience serving populations in these counties further. If organizations meet these additional requirements, immediate advancement to preliminary recognition will allow them to skip the normal 12 to 18-month waiting period to apply for approval as an MDPP supplier and begin to bill CMS. Having access to Medicare reimbursement will help provide additional financial support to help meet the needs of these participants. A second way for obtaining preliminary recognition is if an organization has preliminary, full, or full plus recognition for one delivery mode and applies to deliver the lifestyle change program through an additional delivery mode. In this situation, the DPRP will consider awarding preliminary recognition to the new delivery mode pending a review. A third way to move into preliminary is at the time of sequence 1, meaning 6-month, or sequence 2, meaning 12-month data submission if records indicate that at least 5 eligible participants have attended at least 8 sessions. If an organization does not advance into preliminary based on these 3 ways, they will move into preliminary recognition when both of the following criteria have been met, referred to as requirement 5. The evaluation cohort includes at least 5 eligible participants whose cohorts began 12 to 18 months prior to the data submission month, and at least 30% of the eligible participants meet the definition of a completer. Please refer to Section A of the DPRP standards for information on participant eligibility. Please note that once an organization meets the requirements for preliminary recognition, the organization may remain in preliminary indefinitely if it continues to submit the required data every 6 months. To achieve full recognition, organizations must meet requirements 1 through 4 for pending recognition, as well as requirements 5, 6, and 7, which are listed on this slide and the next one. To fulfill requirement 5, the evaluation cohort must have at least 5 eligible participants whose cohorts began 12 to 18 months prior to the data submission month, and at least 30% of eligible participants must be a completer. Please note Requirement 6 and 7 will only be calculated if Requirement 5 is met. To meet Requirement 6, organizations must demonstrate that at least 60% of completers have reduced their risk of developing type 2 diabetes through at least one of the following outcomes: 5% weight loss 12 months after the cohort began, 4% weight loss and at least 8 sessions associated with an average of 150 minutes per week of physical activity, 4% weight loss and at least 17 sessions attended, or a 0.2% reduction in baseline A1C recorded within 1 year of enrollment. For Requirement 7, organizations must show that at least 35% of completers in the evaluation cohort are eligible for the lifestyle change program based on either a blood test indicating prediabetes or by having a history of GDM. Please note that once an organization meets the requirements for full recognition, the organization may remain in full indefinitely if it continues to submit the required data every 6 months. Now we will discuss our final recognition level, Full Plus. Full Plus recognition is the highest level of recognition that can be achieved, and it means that all DPRP standards requirements have been met. To achieve Full Plus recognition, an organization must meet requirements 1 through 7, as well as the additional criteria listed on this slide. Eligible participants in the evaluation cohort must meet the following percentages for retention: a minimum of 50% at the beginning of the 4th month since the cohort's first sessions, a minimum of 40% at the beginning of the 7th month since the cohort's first sessions, and a minimum of 30% at the beginning of the 10th month since the cohort's first sessions. All organizations must make a data submission every 6 months according to their data submission schedule. Organizations will have access to a progress or evaluation report after each data submission. If an evaluation has not been performed, a progress report will be available. If an evaluation has been performed, the evaluation report will be available that includes the results of the evaluation on the completed cohort or cohorts, progress on ongoing participants who began 7 to 12 months before the submission, and progress on new participants who began 1 to 6 months before the submission. All reports evaluate program results under the current DPRP standards. As organizations prepare to submit data to CDC, they should confirm that listed contacts have SAMS registration. Without this, they will not be able to access the DPRP data portal to upload and submit their data. All required biannual data submissions must conform to the data dictionary found in the DPRP standards and be formatted according to the data entry spreadsheet template. In order to access the data submission module within the DPRP data portal, all organization profile information must be updated and confirmed. Doing so will enable the module. Once the data submission process is complete, organizations will have access to a report that details the results of their progress toward meeting DPRP requirements. Technical assistance is available to all organizations and includes a summary and recommendations section in each progress and evaluation report, scheduled webinars for CDC-recognized organizations, the National DPP Customer Service Center, which is an interactive online resource for organizations, and individual outreach by DPRP team members. The National DPP Customer Service Center provides a one-stop shop for resources, training, and technical assistance for CDC-recognized organizations and other national DPP stakeholder groups. The Customer Service Center provides support in three main areas: resources for enhanced program delivery, technical assistance support, and a peer-to-peer discussion forum. The National DPP Customer Service Center's resources for enhanced program delivery are hosted in large repositories comprised of frequently asked questions, or FAQs, toolkits, training videos, and webinar recordings. To take advantage of the personalized technical assistance support and the peer-to-peer discussion forum, you can create a profile in the National DPP Customer Service Center. This concludes the presentation. Thank you for participating in the Diabetes Prevention Recognition Program.